We've talked about how common anxiety is, how to know if you are anxious, and how severe your anxiety is. We examined a study showing the increased risk of mortality with anxiety disorders. I explained how chronic anxiety leads to health problems. But the question remains, is anxiety something we just have to accept, or is there something we can do about it? Let's take a closer look at some tips for treating anxiety. First of all, I want to say that anxiety is highly treatable. I have been screening for anxiety using the GAD-7 in my practice since before COVID. Before COVID, it was about 10% of patients were screening positive. Now it's about 90%. So I'm talking to people about anxiety on a daily, hourly basis. And these strategies have been tested and are highly effective and have worked for hundreds of people just this year. So let's take a closer look at these recommendations. First is sleep. Getting 7 hours of sleep every night is essential to positive mood. When we do not sleep enough, our bodies go into a fight or flight stress response. It isn't normal to stay up late at night, and our bodies think there must be an emergency. So they're pumping out that cortisol and adrenaline, which further complicates the picture of elevated chronic stress in our bodies, further elevates blood pressure and blood sugar. Getting a good night's sleep is foundational to getting a hold of, treating, and resolving anxiety. These are 11 tips that I find highly effective for getting a good night's rest. I recommend having the same bedtime every night, even on weekends. Limiting naps, avoiding any kind of a stimulant before bedtime. That includes caffeine. It also includes exercise. If you're doing exercise that raises your heart rate and gets you stimulated right before bedtime, it can make sleep difficult. Avoiding alcohol within 3 hours of sleep. Many people find alcohol relaxes them and helps them go to sleep, but alcohol wreaks havoc on our sleep architecture because in the middle of the night, we actually withdraw from alcohol if we had it right before bedtime. And that causes awakenings, which, even if we're not aware of them, disrupt our sleep. Practice a wind down ritual 1 hour before sleep. I go to bed at 9 p.m. every night. At 8 p.m., I turn out the lights, put in Bluetooth headphones, set an audiobook on my phone and start play, set a sleep timer on the audiobook so it will shut off in an hour, turn on the air conditioning so it gets especially cold, get under the covers, turn out the lights. So I'm sitting there for an hour listening to this book and I can't use my smartphone. I put it on the other side of the room. All I have to focus on is this story. I can't do work. I can't look at a screen. Having that 1 hour wind down time is an incredible way of getting a good night's sleep. Number 7, use the bed for sleep and sex. Avoid eating, watching TV, or using your smartphone in bed. Our bodies are like a dog. They will respond to a cue with whatever behavior we want them to respond with if we're consistent. If we consistently show them a leash when we want them to come to the door to take them out for a walk, then they will come to the door when we show them the leash. If when we show them a leash, it means we want to take them out for a walk, or we want to give them something to eat, or we want to reprimand them, or we want to give them a bath, then they're going to look at a leash when we hold it up and have no idea what to do. Same is true with our bodies when it comes to the bed. If the bed is consistently associated with the place for sleep, then when we get into bed, our bodies will take the cue and do the habit we hope for. If, on the other hand, we get into bed and we watch Netflix or read or check our email or do work, then when we get into bed and want to sleep, our body's not going to have a clue what it's supposed to do. So make the bed a place for sleep and sex only. Tip number 8, use a blue light filter on your phone within 2 hours of sleep. You can see in the settings, this is for iPhone users, you go to display and brightness and turn on night shift mode. The blue light that would otherwise come from phones is highly stimulating. It's like looking at the sun. It throws off our circadian rhythm, making it impossible to go to bed if we're using a phone without a blue light filter before bedtime. Wear an eye mask and use earplugs. I don't particularly have a noisy or bright room, but making my sleep environment pitch black and totally silent is amazingly relaxing, and I recommend it. Keep the bedroom as cool as possible, 60 to 68 degrees. Open a window, use a fan or air conditioner. I have a thermometer I have right by the head of my bed, and if it registers anything above 65 degrees, I'm putting on the fan, I'm opening the window, I'm turning on the air conditioner. Having that in your control, the temperature in your bedroom, is really helpful, and sleep specialists agree that optimal sleep temperature is in the low 60s. And finally, tip number 11, if you do wake up in the middle of the night, don't check your smartphone. That will encourage you to keep getting up in the middle of the night to check your smartphone. If you're really worried about work and you need to check your smartphone to know if you got that response, and you get up and check your smartphone, your body gets a little reward for misbehaving. So the next night it'll find some other reason, some other thing for you to perseverate about and get you up to check again. If you refuse that urge and take the cell phone, make it off limits, then you're not going to reinforce that behavior and you'll be able to get a good night's rest.